Okay. Hi everyone, this is Dr. Bukhtawar Azhar from the Infection Prevention and Control Foundation. I am the program manager at the Department of Safe Dentistry, and we're doing today's webinar as a part of our national oral health campaign to elevate the level of oral literacy rate in Pakistan. We have with us Dr. HAMZA HASHIM. Sir, if you could please continue.
Assalamu alaikum, everybody. I am Dr. HAMZA. I'm a consultant oral and maxillofacial surgeon. I'm here at Advanced Dental Practice, and we're collaborating with IPAC Foundation to increase the literacy rate, to how to take care of the teeth and how it is related with the systemic health. And we really want कि हमारे पाकिस्तान के अंदर भी लोगों को awareness हो, so that they're able to take care of their oral hygiene, and so that it may result in better systemic health.
Perfect. Thank you. Thank you so much for the lovely introduction, sir. So, as Dr. Hamza elaborated, that today's webinar is going to be about the importance of oral health, and especially how our oral health affects our overall health, and how different diseases are linked to the oral health. So, before we jump into the technicalities of that, sir, I would like to begin. With this question of understanding if Pakistan में currently, what do you in your professional career, what have you seen कि different stratas जो हैं, different socio-economic class के जो लोग हैं, उनमें oral health की awareness कितनी है prevalent अभी इस वक्त, if we talk about the current situation, what where do you see people in terms of their knowledge about oral health या oral health के बारे में उनकी understanding? What do you think is the current situation in Pakistan right now?
The current situation is so bad. It's so bad that people do not have any idea about gum disease and how it impacts their health. I've seen many surgeons with so bad teeth. Not only talking about the illiterate class of Pakistan, I'm talking about the highly educated class of Pakistan. So I've seen plastic surgeons with no teeth in the front. So and they really they're standing on stage giving lectures, and I just noticed that they have gum disease and they really have no idea how bad it's deteriorating their health. So I would really really take this opportunity to actually spread the word how important it is to maintain your oral hygiene, because I really understand that people, even in the privileged class, don't have any idea about how to take care of their health. And I would really try, it's a very wonderful platform for me to actually spread the word of how it impacts. And I would like to say that periodontal disease is not only an epidemic here in Pakistan, it is an epidemic throughout the world. So it's not only that the people do not know that how gum disease affect their health over here in Pakistan, even in the previous class. People abroad don't, it's an epidemic even abroad. So, and even in the developed countries, people really do not sometimes are able to take care of their oral hygiene, and that is the reason diseases such as diabetes and coronary heart disease, obesity, and all these things are interlinked, and they are all an epidemic, mainly because
I would like to put in a question here before we jump into the details of diabetes and heart disease and how they're linked to it. You talked about periodontitis here and gum disease. अब हमारी जो normal public है, even you talked about the fact that even the educated class, they come into the clinics and they're not really that aware about what periodontitis or what gum disease is about. So if you could, so my question would be if you could throw some light on how many patients, what's the roughly percentage of patients that you see every day that come into you with problems which are not related to their gums, which are related to something else, but you see कि वहाँ पे gum disease बहुत prevalent है और उनको gums का बहुत major issue है, and they have been completely ignorant about it. If you could throw some light on the real life examples that you see, आपकी जो daily practice के अंदर आप patients देखते हैं जिनको ये gum issue होता है.
Actually, the thing is that at Advanced Dental Practice, we really focus on patient education. So So होता ये है, and I would urge all the dentists listening to me right now to focus on patient education. And the thing is कि जब वो पहली बार आते हैं तब उनके पास knowledge नहीं होता, and when they leave तो तब they have all the knowledge that they need, and most of the time they're able to take care of themselves better once they go through us. Yeah. So it's only that it's the first day when they visit, so it's the consultation visit, and we equip them for with all the knowledge that they need to actually take care of their health. And I will tell everybody how to take care of their health. Yeah,
Yeah, okay.
especially their oral health.
We're so
Yeah.
this is exactly the reason we're doing this, ताकि जो भी normal लोग हैं dentist हो, even I would say as dentist periodontal health के ऊपर या gum disease के ऊपर हमारी third year final year में उस तरह से उसको importance नहीं दी जाती है, it's not linked to the rest of the disease. मतलब हमारा एक बड़ा होता है कि अच्छा the patient comes in, they need a filling, we do a filling and they. So this is a very important thing that you've pointed out, that it's very, very important to
So
educate.
I would like to share some light on gum disease.
Okay.
To everybody who's listening to us. So the thing is, the first sign of gum disease is that gums become puffy, and the second is that they bleed. So as soon as you notice that the gums are becoming puffy and they're bleeding, that is the time you need to nip the evil in the bud and go to the dentist and get yourself checked. So जब आप कर देते हैं, neglect कर देते हैं, so what happens is that the bacteria, the plaque that is around the teeth, that when it comes in contact with your gums, it starts to eat away the gums, then it starts to eat away the bone, जिसके अंदर आपके दांत लगे हुए हैं. So periodontal disease is the disease of the gums and the supporting structures that support the teeth. So जब एक बार आपको गम डिजीज हो जाती है और वो पेरिडोंटल डिजीज के अंदर कन्वर्ट कर जाती है and your gums keep on going down, so your teeth are losing support. तो आपको क्या नजर आता है कि if you see pus coming out of your teeth, if you see blood coming out of your teeth, if you see that the teeth are slowly and gradually changing their place, that means they're becoming similar to the Leaning Tower of Pisa, and basically they are leaning down because they're losing support. So naturally, in a situation like that, the first treatment would be to stabilize gum disease. So the first treatment would be to stabilize gum disease, and for that, if a person goes with only gingivitis, only a simple cleaning, which is called scaling and polishing, would actually resolve the issue. But if there's a lot of plaque accumulation on the roots, and there's a lot of calculus deposition on the root surfaces, so the patient might need a root planing and curettage, which is generally referred to as deep cleaning. The worst things that I've seen here in Pakistan is that people would try to grind off the teeth and give bridges before stabilizing the teeth, before stabilizing the gum disease. And the disease that is actually causing the problem is still there, and they've given bridges to add support. So, and that is something that one should be aware of. And most of the time, Pakistan ke andar, there is also a misconception that scaling and polishing is bad for the teeth. This is for all the dentists listening to me. The scaler moves like this. So you're not supposed to touch the tip to the tooth. If you do that, you can injure your tooth, and you can injure the tooth. There are a lot of vibrations that are transmitted to the teeth. So you touch the side of the scaler. This is a professional advice to all my junior colleagues, that when you're doing cleaning, when you're doing a scaling and polishing, do not use the tip. And if you're using the tip, make sure that you're only using the tip to dislodge the stone, because the scaler is supposed to work, and a scaler खुद काम करता है, वो ultrasonic vibrations transfer करता है to the calculus, and it dislodges. Like जैसे किडनी स्टोन होता है तो आप अल्ट्रासोनिक शॉक लिथोट्रिप्सी करते हैं, इस तरह ही आप अल्ट्रासोनिक स्केलिंग करते हैं. Pakistan, it earned a bad reputation. It earned a bad reputation in Pakistan because most of the dentistry being practiced in Pakistan is basically is इसके अंदर बहुत सारा segment है जो non qualified doctors ने occupy किया हुआ है. And the reason for that is that most of the young lot that we have a huge lot coming graduating now, but still they don't come into practice because एक तो हमारे यहाँ वो जो most of the ladies don't enter into practice, and most of the time they are the ones who are very good at memorizing initially, and उनको सब कुछ याद हो जाता है और उनके marks बड़े अच्छे आ जाते हैं, then they enter medical practices, and once they enter medical practices वो डॉक्टर बन जाती हैं.
That's a lot
And
of
वो जब डॉक्टर बन जाती है तो उसके बाद they don't enter practice. So हमारा 70% जो डॉक्टर पूल है वो तो बेसिकली प्रैक्टिस में नहीं आता. अब जो पीछे जो 30% बच्चे रह जाते हैं, जो लड़के रह जाते हैं, वो they're surely misguided, and उनको बिल्कुल रूट नहीं समझ आ रही होती कि हमने स्पेशलाइजेशन करनी है, हमने क्लिनिक बनाना है, एंड या फिर हमने बाहर जाना है. तो ज्यादा इधर कहते हैं कि हम बस बाहर की तैयारी करें, इम्तिहान दें और किसी तरह बाहर इस सिस्टम से हम निकल जाएं, क्योंकि यहाँ का सिस्टम. My advice to all the dentists: when you become a dentist, you are a dentist if you're practicing. If you're not practicing, you're not a dentist. सही है? So चाहे आजकल clinics बनाना is very it's very easy, and I would urge all the young doctors to open up their practices and start working, start giving quality treatments to their patients, work at some good place initially so that you know how to deal with oral diseases and serve the public. normally हम जब हम बच्चों को एडमिशन दे रहे होते हैं तो हम डाइवर्सिटी एंड इंक्लूजन को फॉलो करते ही इसलिए हैं ताकि we can actually have people from all segments of society. And when we have जो admissions हो जाते हैं तो we want them to we want doctors to actually come and become graduates and start serving in those areas which they actually belong to. So it's very important that we do that, and इस तरह ही हम ज़्यादा community को ज़रा लेके चलेंगे तो इसी तरह ही हमारी oral health भी बेहतर होगी.
Sir, something you mentioned while you were discussing scaling and polishing and all of these things. One of the very important questions here and a misconception for the public out there is that they do not know the difference between scaling, polishing, and whitening. They kind of correlate all of these things all together. So many normal people, but the very well educated people still. But unko,
I understand the question. I'm going to tell. Okay, so to all the public, जब आपके दांत पीले हो जाते हैं तो that the solution to that is not whitening. There are two types of stains. One is the stain that is on the surface of the tooth. One is a stain that is inside the surface of the tooth. I'm going to explain you both. So the stain that is on the surface of the tooth can be cleaned with the scaling and polishing. Right?
Yes.
So the stain that is on the surface of the tooth can be cleaned with the scaling and polishing. And जब आप कॉफी पी रहे होते हैं तो आपके जो दांत होते हैं they're just not made up of a calcium block. They have protein channels in them. And when you drink coffee, like I'm drinking right now, when you drink that coffee, so what happens is that the protein channels, जो 3% protein channels हैं on the surface of the tooth, उसके अंदर कॉफी चली जाती है. प्लस जब हम चाय भी ज़्यादा पीते हैं तो चाय के अंदर टैनिक एसिड होता है एंड साथ चाय का रंग भी होता है. So both of them, stain अंदर चला जाता है दांत के.
Right.
तो जब stain अंदर चला जाता है, for that you need 40% hydrogen peroxide. 40% hydrogen peroxide, you basically it's a separate procedure. Bleaching is a separate procedure. आप gingival barrier लगाते हैं. Gingival barrier लगाने के बाद आप well reputed company का 40% hydrogen peroxide लगाते हैं only on the surfaces of the tooth. जो light आप उसके ऊपर डालते हैं वो basically एक सिर्फ और सिर्फ marketing gimmick होता है all the thing that is being done is the uh, by the uh, by the gel itself. And वो दो ट्यूब्स होती हैं जिसके अंदर एक्टिवेटर डला होता है, तो you don't need to actually further activate it with a light, but light does one thing, वो टेम्परेचर रेज करती है जेल का, so जिसकी वजह से वो जो रिएक्शन होता है वो थोड़ा सा जल्दी होता है, and that is all that the light does. So yeah, I hope I cleared the question. I hope this was the exact
Yeah,
question.
yes, it was. It was. Thank you for answering that question. The next thing I would like to move on, because of the limitation of time, would be to move into the direction of, because we were talking about gum disease, how gum disease is, closely linked to one of, like some of these really important diseases related to the heart and others. So if you could like just dive into that.
Okay, so that is the very big question. That is the holy grail कि how your mouth is linked with your health, oral health. यानी कि मुझे ये नहीं समझ आती, the thing is if you don't maintain oral hygiene, तो होगा ये कि कभी आपने कभी फ्रिज अपना बंद छोड़ के कभी घूमने चले गए हों, जब वापस आए हों तो आपने हाल देखे घर का क्या हुआ होता है, it stinks. So it stinks because of all the bacteria that is cultivating in the fridge and all that. अब जब पेशेंट को हार्ट का प्रॉब्लम होता है तो अक्सर औकात उनको एक छोटी सी गोली देते हैं जिसको एंजिसेट कहा जाता है. अब वो जो एंजिसेट है वो जो बंदा जबान के नीचे रखता है, स्ट्रेट अवे गोज इनटू द हार्ट एंड द हार्ट स्टार्ट्स, उसकी ऑक्सीजन सप्लाई बढ़ जाती है एंड स्टार्ट्स पंपिंग. द माउथ इज अ reservoir for bacteria, and when you don't take care of your oral hygiene, what happens is that all this bacteria goes inside the body via inferior vena cava. So it goes inside the blood and it goes inside the heart, and it is catastrophic. अब होता क्या? So जब आपको gum disease होती है तो there is a lot of bacteria in the mouth. The bacteria, the toxin, it goes directly inside your body. Second ये होता है कि जब आपको gum disease होती है तो there is a lot of surface area, तो आपका overall inflammation का level raise कर देता है. जब वो overall inflammation का level raise करता है तो दो चीजें होती हैं. एक तो आपका सी रिएक्टिव प्रोटीन लेवल बढ़ जाता है, एंड स्टडीज ये कहती हैं कि आपका जब सी रिएक्टिव प्रोटीन लेवल बड़ा होता है तो यू आर एट रिस्क 3 times more risk of developing or having a stroke. ठीक है, नंबर 1. सेकंड चीज क्या है, आप व्हाट इज डायबिटीज. अब मैंने पहले आपको ये बताया कि हाउ डज इट अफेक्ट द हार्ट. अब डायबिटीज also affects the heart, and diabetes की जो insulin resistance होती है that is linked with the oral hygiene and gum disease. I'm going to explain you how does that happen. So when अब sugar क्या होती है, हम कहते हैं कि उस बंदे को sugar हो गई, तो what does that mean? That means we all take sugar, but what is so special about the patient who is diabetic? तो जरूरी बात यह है कि what you understand is कि जब एक बंदे को शुगर होती है तो the sugar that is in the bloodstream is unable to go into the cells. Okay? Yes. So sugar that is in the bloodstream goes into the cells with certain gates. उन gates को कहते हैं glucose insulin gated channels, glucose gated channels. ठीक है? Insulin binds to that gate and opens the gate, and then the sugar goes into the cell and आपके blood के अंदर sugar normal. In a case जिसके अंदर आपको sugar high है, आप insulin लगा रहे हैं, आप 50 units of insulin लगा रहे हैं, मगर the sugar is not coming down, इसका मतलब ये है कि something is not letting the glucose gated channels open. And that is because of C-reactive protein. So C-reactive protein goes and binds to the insulin receptors on the glucose, on the cells, on the glucose gated channels, and permanently locks it. अब आप insulin लगा रहे हैं, आप कुछ भी कर लें, the sugar is not going to go inside the cells. Okay. Right. Having said that, the thing is that I was working for University of Michigan back in 2009. It was a research program in which the funding was being done with International Team for Implantology, and it was supervised by University of Michigan and in our Lahore. And what we saw is that जब हम patients की gum disease खत्म करते थे, and उनका C reactive protein level नोट करते थे, तो the C reactive protein level used to go down. So that means कि once we remove the infection from the gums, the overall inflammation reduces, and when the overall inflammation reduces, the insulin starts working again and आपका glucose control हो जाता है. So second चीज ये है कि once you have gum disease, तो आपका support खराब हो जाती है दांतों की. So your teeth become a little weak. So आप क्या करते हैं कि आप कहते हैं कि मैंने fibrous चीजें नहीं खानी, मैं गाजर नहीं खानी, मैंने मूलियां नहीं खानी, मैंने सलाद नहीं खाना, मैंने सेब नहीं खाना, ठीक है?
Right.
मैंने गंडेलियां नहीं खानी. So all that. तो in that situation आप क्या खाते हैं? आप बर्गर खाते हैं, आप नान खाते हैं, आप क्या खाते हैं? आप सॉफ्ट चीजें आप कहते हैं मैं तो सिर्फ व्हाइट ब्रेड डिबो के खा लेता हूँ या खा लेती हूँ. So the thing is कि these are all high glycemic index वाले food. They cause a sugar spike in the blood, and when they cause sugar spike in the blood, body क्या करे? So हमने ये देखा कि once you have strong teeth, तो आप सारे fibrous foods खाते हैं, तो जो आपकी sugar level spike नहीं करता, तो आप मोटे भी नहीं होते. So that's how we linked obesity with gum disease. I hope it's quite clear. Yeah.
So we like definitely understand that, you know, taking care of your gums, not taking care of your gums is actually contributing to so many other diseases, you know, that just go. So a lot of people are taking care of the diseases, but वो gum disease को ignore कर रहे होते हैं.
I would like to add one more thing.
Yeah, sure.
This is very important to understand. When you have more sugar in your bloodstreams, glucose is a small molecule. When you have high percentage of glucose in the blood, it binds with the hemoglobin molecule, making it a bigger molecule. A bigger molecule is more viscous. It's like honey. So just imagine your heart trying to pump honey. Yeah. It's gonna be tough, right? Yeah. Just imagine this honey type blood going into the retina, causing retinopathy, going into the small capillaries, not being able to supply oxygen to the nerves, causing neuropathy. Then going into this shahad numa blood going into the kidneys, causing nephropathy. So and once you get into this cycle, your health is constantly going down the drain.
Yeah. Sir, यहाँ पे, you know, I would ask another question कि if you could, you know, then this question is again for the public, कि क्या ऐसी चीजें, like what are some of the things that you would tell people for them to be able to identify their gum disease at an early stage? और क्या इसका solution क्या है कि, you know, dentist के पास आपका किस तरह का आपका relation होना चाहिए एक अपने dentist के साथ to be able, for you to be able to prevent yourself from all of these things?
Okay. So the first thing is that if you brush your teeth and you see signs of bleeding, that means it's the start. Second is that everybody needs a professional cleaning from a good dentist everybody recommends twice every year, but as we're Pakistanis, तो मैं आप लोगों को थोड़ा सा relaxation दे देता हूँ, आप साल में एक दफा स्केलिंग करा दिए. मगर the thing is कि अगर आपके हल्के से gums puffy हो जाएं, bleeding हुए, आप अगर उसको press करें और आपको ऐसे लगे जैसे यार there's something going wrong, और अगर आपको ऐसे लग रहा है कि खाना फंस रहा है किसी जगह पे, आपको लग रहा है कि आपके सामने वाले दांत अपनी जगह से हिल के spacing आ रही है, तो these are all signs that you have gum disease and you're putting yourself at risk of all these other diseases as well, let alone your teeth. So treating gum disease is very, very important.
Another thing,
मैंने 5 चीजें बताई. अच्छा, मैंने 5 चीजें बताई. One is puffy gums, second is bleeding, third is आपने press किए तो pus आ रही है, fourth is that आपको ऐसे लग रहा है जैसे आपके gums आपके दांतों को छोड़ रहे हैं, और उसके बाद मैंने आपको ये बताया है कि they're changing their position. I hope this is very clear signs and symptoms that you can see and examine yourself. Third is that if you look on the back side of your teeth and you feel as if there's a lot of chunks of stone there, this chunk of stone is actually a reservoir of bacteria and you need to get it cleaned as soon as possible.
Yes. सर एक और चीज जो मुझे लगता है कि थोड़ा सा इट काइंड ऑफ मिसगाइड्स द सोसाइटी थ्रू टेलीविजन और थ्रू एडवर्टाइजमेंट्स एंड ऑल, इसके बहुत ज्यादा एडवर्टाइजमेंट होती है इस चीज की कि अगर आपके मसूड़ों से खून आ रहा है तो XYZ टूथपेस्ट यूज करें. आई हैव नो आइडिया हाउ कैमरा इवन अलाउज दैट बिकॉज दैट इज
अच्छा,
सच
अब यानी
मिसगाइडेड.
यानी कि मैंने एक चीज बतानी है. There are two types of mineralized bacteria that surround your teeth. When that mineralized bacteria is attached to your gums, it is causing the bleeding. अब आप एंटीबायोटिक्स खा लें, टेम्पररी रिलीफ हो जाएगा. अगर आप कोई फलानी टूथपेस्ट जो उन्होंने कहा है कि इट्स वेरी गुड वो इस्तेमाल करें, टेम्पररी रिलीफ होएगा. मगर सबसे बड़ा प्रॉब्लम ये है कि द स्टोन दैट इज ईटिंग योर गम्स is still there and it needs to be professionally removed and you can't remove it yourself. And होता ये है कि पाकिस्तान के अंदर क्वैक्स जो हैं वो करते ही हैं कि जब एक बंदा स्केलिंग एंड पॉलिशिंग कराने जाता है तो वो डायमंड बर पकड़ के आपके दांतों को रगड़ देते हैं एंड कहते हैं कि जी आपकी स्केलिंग एंड पॉलिशिंग हो गई. अब when जब हमारी हमारी अनपढ़ पब्लिक सॉरी हमारी इलिटरेट पब्लिक जब ये चीज देखती है तो इट सेज कि मे बी द प्रोसीजर वाज रॉन्ग. इट वाज दे डोंट इवन केयर कि दे आई डोंट नो कि दे थिंक कि a dental service is similar to something buying off the shelf. ठीक है, it is not something like buying off the shelf. Every practitioner some practitioners are more professional, some professionals are not that concerned about their patients. So you need to be very mindful of the fact who you're going to. Plus, when you pick up a place, the only criteria of that place should not be that it's very cheap, because आपको the cheapest form of dentistry is the one that is done right, and the most expensive form of dentistry is the one that is done wrong. So you don't want to actually get yourself into trouble like that. So scaling and polishing earned a bad reputation in Pakistan just because of non-qualified doctors. Practice non-qualified people in fact practicing.
और सर अगर आप थोड़ा सा इस चीज को हम लोग मतलब अफोर्डिंग क्लास की तो हम बहुत बात करते हैं दे कैन अफोर्ड ऑल ऑफ दीज procedures और चलो हम उनमें अवेयरनेस क्रिएट करते हैं, they'll get those procedures, that's one thing. But if you could also talk a little about जो हमारी unfortunate class है पाकिस्तान की, the people belonging from lower socio-economic class, उनके लिए what do you think are some of the measures that we should take के government level पे या जो हमारे trust hospitals हैं यहाँ पे scaling polishing, क्योंकि यहाँ पे भी हम scaling polishing it's very necessary for everyone.
18th century के अंदर there was a lot of non-qualified people in the UK.
Okay.
And what the government did is that they were treating a certain segment of the population instead of closing them down and to stop their उनकी भी रोजी रोटी बंद हो जाती थी. एंड पेशेंट्स जो उनके पास कुछ ना कुछ तो ट्रीटमेंट ले ही रहे थे ना, जैसे हमारे यहाँ पे वो बेशक खराब काम कर रहे थे. आई वुड से कि अगर ये क्वैक्स हैं भी तो एटलीस्ट उनको कुछ थोड़ा गवर्नमेंट साइड से कोई एजुकेशन हो जाए, बिकॉज देव एक्चुअली ट्राई टू क्लोज देम डाउन एंड बहुत ज्यादा वो क्लोज करने की कोशिश की है, बट अनफॉर्चुनेटली दे पॉप ओपन राइट अप. And I think it was a failed strategy that the government followed of immediately closing them down and putting pressure on them and all that. I would say कि उनको थोड़ा सा educate कर दें ताकि they would. I don't know. I think a government will be the better judge on that. But if I was a part of the policy making, I would actually train them to do proper scaling and polishing at least, because उनके पास setups तो हैं ही. उनको स्टेरिलाइजेशन अच्छी करा दी जाए और वो स्केलिंग एंड पॉलिशिंग तो एटलीस्ट कर ही सकते हैं. तो आई वुड एक्चुअली टेल देम कि जो है ना काम अच्छा कर.
I mean, the long term solution is to obviously not have any quacks. But again, you make a very fair point that instead of taking such a like to close them down entirely, instead of like a gradual transition.
Yeah, it has to be a gradual transition. Now, I mean, हमें डिस्ट्रक्टिव बाय नेचर नहीं होना चाहिए, ठीक है?
Yeah.
है हमारे हमारे पाकिस्तान के अंदर लोग पीपल आर वेरी डिस्ट्रक्टिव बाय नेचर, को इसको बंद कर, इसको बंद कर दो, और इसको मार दो, और ये कर दो. नहीं, इट्स नॉट, दिस शुडंट हैपन लाइक दैट. I
Yeah.
personally think that there is always a win-win situation in every situation. To find that win-win situation is very important, and I think I think the government should be also be mindful of the fact कि इतने hard line rules don't work and they fail at the end, and all your efforts definitely become futile. So
And all the efforts need to be long term. So yeah, you definitely make a very fair point. The next question would be about, so we've talked about brushing, we've talked about toothpaste, we've talked about gum disease. Very important thing that I think we missed so far is the importance of flossing. If you could spend
yes.
as much time as you want on the
So,
importance of that.
I would really want to everybody to understand कि आपके दांत के 5 सर्फेसेस, एक सामने, एक पीछे, एक ऊपर, एक इस साइड पे, एक इस साइड पे, नीचे तो जड़ें हैं ना, सो वो वाली साइड नहीं होती, बाकी इट्स लाइक अ क्यूब. सो इफ यू brush all sides, ठीक है? And but you can't, if अगर यहाँ पे भी दांत है, उसके आगे भी दांत है, so thing is that if you don't floss, जो दरमियान वाला एरिया जहाँ पे खाना चला जाता है, that is very important, and you can't miss on flossing. And अगर आप फ्लॉस करें और ब्लीडिंग हो रही हो, तो दैट मीन्स आपका इफेक्टिव प्लाक कंट्रोल नहीं है. सो उसके लिए जस्ट विजिट योर डेंटिस्ट वंस, वो एक क्विक क्लीनिंग करें और उसके बाद आप इफेक्टिव प्लाक कंट्रोल रखें. अब व्हाट इज इफेक्टिव प्लाक कंट्रोल? व्हाट इज प्लाक? Plaque is a layer of bacteria that surrounds your teeth, your gums, and when you don't brush it, उसके ऊपर mineral deposition होती है and it becomes calculus. When this plaque layer comes in contact with your gums, it causes bleeding. So effective plaque control is very important.
Yeah. Sir, another question that I think I would throw in there is that what do you think that the dental community as a whole, what should be their take-home message in terms of how we can improve upon the habits of our patients? Because वही आपने जो बात की कि आप implants करा रहे हैं, आप crowns लगवा रहे हैं, इतना आप लाखों का treatment करा रहे हैं, but your gums are,
Oh,
inflamed. So what
no.
do you think the
The thing
dentist?
is, the thing is कि implantology आप कर ही नहीं सकते अगर आपने gums को stabilize नहीं किया. Okay, number one. So अगर कोई कर रहा है तो ऐसे ना करें, ठीक है? Because ultimately the implants will fail. So
I will give you.
oral hygiene.
I
Oral
want to
hygiene.
just before you answer that question, because I want to give you an example, a real life example. My own uncle, he had gotten so much work done in his mouth. I'm obviously not going to take the name of the dentist. Multiple bridges and crowns and everything, and the dentist did not call him once in those 3 years since he'd gotten the treatment done, once for scaling. So for somebody to have so much, dental treatment done, and their dentist is not wary of the fact कि आपको हर 6 महीने, my uncle's like मुझे तो कभी किसी ने कहा भी नहीं, मेरे dentist ने भी नहीं बोला कि हर 6 महीने बाद you have to get your scaling done.
मैं आपको एक चीज बताता हूँ. It's very difficult to actually call on every patient of yours. So it's they have to take this responsibility on themselves कि हमने आपको बता दिया है कि अपनी oral hygiene maintain करें, और साल में या साल में 2 बार कम से कम क्लीनिंग कराएं, and we have equipped them with the knowledge that they
Actually,
need. They have the knowledge. Problem in Pakistan is that when we call them, they think that we're calling them for ourselves.
yeah, true that too.
Yeah. So we're not calling them for ourselves. We're just reminding them that you need to get your cleaning so that you may have your teeth till the age of 80. So the problem in Pakistan is that when a clinic gives a call to the patient, they think I think they need they want to do cleaning. I don't know. Why is that? ठीक है? And पूरी दुनिया के अंदर when you give a call तो सारे कहते हैं कि thank you for the reminder. हमें कहता है वो देखे डेंटिस्ट की कॉल आ रही है. So
I think the first point that you mentioned is very important कि जब आपका पेशेंट का पहला विजिट है, मतलब उस टाइम पे उनको एम्पावर करना, उनको एजुकेशन देना कि आपकी स्केलिंग क्यों इतनी इंपॉर्टेंट है, बिकॉज अ लॉट ऑफ पीपल उनको ये बात पता ही नहीं होती है कि स्केलिंग करानी भी इतनी जरूरी है. दे जस्ट इवन इफ दे हैव बीन गोइंग टू द डेंटिस्ट, उनको इस like the dentist a lot of dentists I feel like they don't empower their patients enough कि उनके ज़हन के अंदर ये drill करें कि you how important this is.
Yeah, and
Would you
I
agree
think I think dentists should set an example and अपनी पहले सबसे पहले सारे cleaning करवाएं after every 6 months,
with that?
ठीक है? And I get my teeth cleaned after every 6 months, सही है? So if I can आप वही चीज advise कर सकते हैं जो आप खुद करें. And मैंने पाकिस्तान में देखा है कि dentist अपनी scaling हर 6 महीने बाद नहीं कराते. So,
That's true. A lot of dentists don't even believe in that.
so it's very difficult to it's very important to actually practice what you preach.
Yeah.
So make sure that you go to a dentist who has teeth जिसके अच्छे दांत हो.
Yeah. No, both of us are smiling with our wide smiles now.
Yeah,
That
no,
is,
actually the thing is that I really get my scaling done after every 6 months. That's why
yeah.
I'm able to prevent myself from gum disease. And
Oh,
I actually really share my photographs as well on my stories कि मैंने जो है मेरी scaling हो रही है.
yeah,
So
yeah.
that is
That's
how
very
they
good.
end.
Yeah.
आपने
Okay,
देखी
okay.
भी होगी.
Yeah, for sure.
Yeah.
This was great, sir. So I think we'll end this here. And if there's any ending remarks or anything else that you would like to add before we conclude today's webinar.
I would like to thank IPAC Foundation for taking this initiative so that they're spreading the awareness about oral hygiene here in Pakistan, oral hygiene and safe dentistry. You're doing an excellent job. I would really recommend. I would really want कि इस तरह की चीजें ज्यादा हों ताकि हमारी पब्लिक तक कोई एक्चुअल इंफॉर्मेशन भी जाए बिकॉज हमारे न्यूज चैनल्स तो कुछ बताते नहीं हैं.
Thank you so very much. Thank you so very much for joining today's webinar, sir, and hope you have a
Take
good day.
care. Take care.
Thank
Allah
you.
Hafiz.
Okay.
Allah, Allah,
Gracias.
Allah.